what I'm going to be doing first is irrigating. Now I do the irrigation as I'm working. That cuts down on the wiping because the wiping can be very irritating to the skin. And as I'm tattooing, I will hold her eye how it needs to be. She doesn't have to worry about holding her eye any certain way. So this is the machine that I use. The needle is in the machine, and then I'm going to be getting the pigment from my little well, and I'll be tattooing that into her skin. So your eye's going to feel a little bit open. I'm going to turn you just a bit. Good. You let me know if anything bothers you. Okay. So I hold the skin pretty snug. And it's going to feel kind of like a little vibration. Doing okay? Mm-hmm. Just keep your eyes closed. Mm-hmm. And the key with this is definitely, you know, you want to be getting it right in the lash line. Turn just a hair. Good. And if you guys have questions as I'm tattooing, don't hesitate to shout them out. Is it prickly at all? Mm-mm. Good. And you can even ask Kim questions. Kim did not take that oral sedative. She chose not to. And you can see she's doing fine without it. Now I'm going to go to the upper lid here. When I'm all done, she'll be standing up and you guys can take a look at her. We were trying to do the screen, but it wasn't working, so are there any ladies that I've worked on that want to stand up and talk about their experience today? Joyce or Joanne, you guys want to say anything for me?
I just say she was wonderful.
Oh.
I took the Valium. I got the eyeliner done last year this time, and I didn't have a problem at all. And as everybody has attested to Stephanie, and I think great work is a great resource. It made it very comfortable and very easy.
Thank you.
Be patient.
I want to say that your work is very natural looking, especially with the little strokes that you do. And so my fear was that it would be, you know, like it would look like paint on you or something. Mm-hmm. But it doesn't. It looks very natural, I think. So I was very happy.
Thank you. So what I do is I do a few passes and then I'm going to reapply some additional numbing now to this side, and I'll be going over to the left side. Doing okay, hon?
Oh, I'm fine.
Good.
This is surprisingly, I think I was expecting something different.
So she just mentioned that she was expecting it to be a lot more difficult. Yeah. And she's tolerating it great. So I'm going to reapply the numbing and make it a little bit of a sting here. Already just with those few passes, we have quite a bit of that nice color there. Now I'm going to go to that side.
Stephanie, are you doing upper and lower?
Yes, I'm doing upper and lower. So as I mentioned on the other side, now I'm coming to this side and I will be irrigating. I don't mean to have my back to you, but... And as I said before, the irrigation cuts down on the wiping because the skin gets very aggravated if you're constantly wiping it. So we try to keep that to a minimum by using the irrigation. Oh, sorry guys. So what I'm going to have you do is turn just a bit. Good. And I hold the lid very snug. Doing okay? Good. Now I'm going to go to the upper lid here. Sorry guys. So I put the pigment in the lash line. What you don't want is a big gap between the lash line and the color. You doing okay?
Right on the inside.
Inside corner. Okay.
Yeah, that's it though. Otherwise it's a tickle actually.
I'm going to add some more numbing here in just a moment. We'll go back to the right side.
It's like a tickle. I was not expecting it.
You thought it would hurt more?
Yep. I love that you go on the lash line.
Yes, it's so pretty.
Because I see gaps in some people.
Yes. Well, and you know, that's the thing is if it's not done properly, it's not. Where did my one gal go? I was going to have her talk, but she stepped out. Probably because they're doing a drawing over there. So now I'm going to put some additional numbing here and go back to the right. But I'm going to have her turn her head. So go ahead and open here.
I can open my eye?
Yes, the left one. I don't know if you guys can see, there's just a little bit of color starting. You see that? And with her eye color, it's gonna look gorgeous because that's her eye color. So it's just gonna make her eyes really pop and not look, you know, like black around her eyes. She wore this green color, so it's really pretty. Okay. Any questions at all so far? Okay. So I'm going to put some more numbing here. It will sting for just a moment.
The inside is definitely on top.
On the inner. Okay.
On the upper.
Okay.
How are you doing, Kim?
Great. Okay, this sounds silly because I'm telling her it kind of tickles is the only way. I was expecting something different. And there's it's like a tickle. I'm pleasantly surprised.
Good.
Yeah.
That's what we want. Yes, so the main colors are, I do have a plum color, and then couple different greens. She's doing like a lighter green, a less intense green. There's another green I use that's really pretty too, but it's very bright at first. Lots of pictures in that photo book you can look at of the greens. Then I do a few different blues. I do a lot of the black brown and a lot of black. So it is optional depending on the patient, but I do tell people you kind of want to stick with what you're used to. So if you're not someone who's wearing a color, probably not the best time to tattoo it that way unless you give it a trial run, you know. And some people will do that. They'll try out some makeup and then they'll say, oh yeah, let's do it, I like it, you know. So now I'm going to come back to the right side here. So now it should be even less prickly because we've had the numbing sitting here. And as I said earlier, some of you might not have been in here. This is done in 2 sessions, usually about 8 weeks apart, because what you're going to do at the second session is you're going to thicken it and darken it. It's kind of like putting 2 coats of nail polish on. You want to really kind of intensify that color. All right, so your eye's going to feel a little bit open again. A little better? Good.
Definitely better on the inside.
Better? Good.
Yeah. It would be very different without the numbing medicine.
Oh, yeah. So when Kim is done today, she is going to have some swelling. And I tell the patients they definitely want to have at home a little cold compress that they can use for a few times the first few days. That helps minimize that puffiness. It kind of makes you look like you've been at a sad movie and been crying. And it's variable. You know, some people get a little more puffy than others, but it's nothing too terrible. The eyelid skin is the thinnest skin in the body, so as I was saying earlier, you definitely want to be conservative and not overwork the skin.
as Stephanie's working on this, for those of you who want to enter the raffle for the permanent makeup, so for those of you who want to enter the permanent makeup raffle, there'll be another
I'm going to
one.
have you
Stephanie's
open
gonna
the
be
right
doing
eye.
another model this
Yes.
afternoon, I believe.
Okay, close.
So, but for those of you who want to enter this raffle this morning, here's the box. We can pass it around. And then once she's done, we're going to be drawing a winner.
They don't do eyebrows.
Got to be present to win, because we're just calling out the number.
Yeah.
Right? So you have 10 sets of tickets and duplicates. So you give us one, and then you hang on to the other one so that you know what your number is, right?
I was mentioning earlier before some of you came in this room that Kim, my patient here, Dr. Husto did her upper eyelid surgery in November, a blepharoplasty, the same surgery he's going to be doing live today at noon. Now she's having this beautiful eyeliner to accentuate her eyes, and a lot of patients often do that. They will have either the liner done, and I'll tell them, you know what, you should get your eyelids done, you're going to see your eyeliner better. Or they'll have the blepharoplasty, and then they want to showcase their new beautiful eyeline, you know, the lid crease. So they'll come in and we'll do the eyeliner.
Tell them I'm going to talk about that.
So when we do, for those of you who are interested in eyelid surgery, when I do the live surgery at noontime, and we'll be narrating everything. I'll be narrating everything from the moment I draw on the patient, wheeling them to the operating room,
Doing okay?
numbing them, doing the procedure, wheeling them back to the recovery room, and then I'll
Dr.
be bringing
Husto may
them
not
out.
even know I'm the
So
one
you
talking
can talk to
before.
the patient.
Yeah.
And we're going to be live streaming it here. So you can see it here.
My
you know,
experience.
up close and personal for those of you who have the stomach for that, right? If you don't think you have the stomach, just turn away. Because not everyone, I know my wife, there's no way, I did her eyelids 15, 16 years ago, but there's no way she wants to watch it. So she's just not cut out for that. Did you have a just so that I know what's roughly the ETA?
Probably 15, 20 minutes.
Okay, all right, so I'll be back. So Stephanie's working on this. Again, Dawn will have the raffle bucket there.
And Kim will be talking when we're done, because she's going to talk about her eyelid surgery experience. She's going to talk about today, what she thinks about having this done. And everyone's she's happy to let you come right up and look right at her eyeliner.
But I think at certain weddings, when you hear that sound, it's a good thing, right?
Yes, that's the hoopah, or what is
It's
it?
a wedding! It's not only a 30-year gala, it's a wedding. Think of it that way.
Doing great.
Are you happy?
Looking so beautiful. Does anyone have any questions on the tattooing?
How long can you have to wait until the eyelid surgery to have your head done?
Okay, so if you have the eyelid surgery first, you would want to give yourself about minimum 6 weeks before we tattoo, just because as you can see, I'm tugging quite a bit on the lids, and we don't want to be tugging right after eyelid surgery. If you have the eyeliner done first, you just want to give yourself about a week, and then you could do the surgery. So for Kim, we're doing a very pretty green color. It's kind of a soft green because she has green eyes and she wears green eyeliner. The color choice is completely up to the patient. Of course, I'll give you my input too when we do the consultation. but everyone's different what color they like. So some people would never entertain the idea of doing a color, and other people, that's, you know, it looks gorgeous on them. So I'm going to have you open the right eye for me. Beautiful. Just a touch more on the right side.
Since I know you guys this isn't hooked up in this room, so it should not block her out, but for those of you in the rest of the office building, we're finishing up the permanent makeup, and we're going to be doing the first permanent makeup raffle right now in about the next minute. So for those of you who can hear me, who are somewhere else in this office, if you want to participate in this raffle, again, there'll be another one this afternoon at what? At 1:15. So when I'm done with the live eyelid surgery, then Stephanie will be doing another permanent makeup, and then we'll do another raffle after that. So basically, if anyone wants to participate in the permanent makeup raffle, speak now for this one. Here's the box to put your ticket in. Anyone else?
I am so pleasantly surprised.
Good.
That's crazy.
So what I'm going to have you do is open the right eye. That way you can get a, and look right up here. Beautiful. Gorgeous. Okay, close. So the right eye is done. I'm going to go back over to the left.
Anyone else for the permanent makeup raffle? Come on down, push your way through. You say excuse me, say excuse me. Okay, we got you covered. Permanent makeup raffle, come on down to this side of the office.
How long does a permanent eyeliner last?
It's permanent, so it is going to be there forever, but over time it will fade, and you do have to come in periodically to have it touched up. It depends on the color and the patient, but I would say the average touch-up is about 2 to 4 years. Yes, Dawn's had her eyeliner and eyebrows done here. This is my sister, actually. We've worked together for 19 years. Can you believe it? Here, for 19 years. So, we love each other dearly.
I was only 25. I was only 25 when we started.
Is that true? I don't know about that.
Okay, so here we go. Again, this is, for those of you who miss out, we'll have another raffle this afternoon for permanent makeup, but this is I'm going to call out the whole number. The whole number, so that there's no confusion. You got to get the whole number. Partials don't count.
Sorry.
Partials don't count. You guys ready? Everyone's looking. I'll give you a minute. Everyone's looking in their purse in their bag. So,
Okay, it should be less
I know
crazy.
that this function has just barely gotten started, but so far so good?
Yes.
Okay, excellent. I recognize a lot of faces out there, and there's a few I don't. Are there just any general questions about the practice, about my felony record, about anything? It's a joke. It's a joke. I don't have a felony record. Just a murder record. Okay.
He should not quit his day job for comedy.
370-7703. 370-7703. That's the whole number.
Better?
It's kind of like the lottery thing, you know? It doesn't count if you just have the Powerball. You got to have the whole thing.
Dr. Gusto, over here.
Okay, come on down.
Woo, it's just like Bob Barker. Dawn, you're like Vanna. Oh, that's different talk or game show. That's Price is Right.
Price is Right. I remember that from being a kid. I haven't seen Price is Right since I was a kid. Don't forget to spay and neuter your pets. Anyone get that?
Yes, he used to say that at the end of every show.
Really working it hard. Okay, let's see that again. Trust but verify. ever hear that? Trust but verify. 370.
And again, we will be doing another makeup one this afternoon, and all these.
There's our winner.
Woo! Yay!
So any questions, whether about permanent makeup, about eyelids, about the injectables, or Roxanne? Actually, I need to get over here pretty soon. Because we're going to be doing, well, as soon as Stephanie's done, for those of you who are interested, you need to go see the two ladies in the yellow, bright yellow-green vests. That will be Sherry and Bree. They have the balloons. And talk to them about getting your promotional discount today. It's today only. And then after that, go to the other stage on the other side, and Roxanne is going to be doing injectables for Dysport and Restylane. Yes, ma'am?
What's the touch-up? How often does it actually touch that?
Stephanie, how often does it have to be touched up?
The average is every 2 to 4 years, but you want to keep it up. You don't want to let it fade out to nothing.
Any other quick question for me?
I'm going to have you open both eyes.
Look
Look right at
Any other
me.
questions?
Too bright.
Sorry, honey. Okay, close.
Thank you very much. Remember, Stephanie will be back at around 1:15 after the eyelid surgery to do another patient.
So when I get done with Kim, which is about maybe 10 minutes, we'll be done. You guys will be able to take a look at her beautiful new eyeliner. You can ask her any questions. She'll be completely upfront with you, tell you how it was. Now I'm going to have you open both eyes again. Good. Close. Now I'm going to go to the upper lid here. We're on the home stretch. Any questions on the makeup, anyone?
How long does it take to recover from this?
So for 5 days, I don't want you to wear any makeup. You'll be putting Aquaphor ointment on twice a day for the first 2 days, and I'll give that to you. You will look a little beat up for a couple of days, so you'll want to have some cold compresses that you can do a couple of times a day for the first few days. You can shower right away. You just don't want to be washing that area vigorously. You want to just let the water kind of run over it and then pat it dry. No underwater swimming for 5 days. And you can pretty much do the majority of your normal activities. I just don't want you to get real hot and sweaty for a couple of days, because when the skin perspires, it's going to push that perspiration to the surface, and that can cause that color to fade. So for a couple days, you want to just kind of be mellow on your activities as far as working out and that kind of thing. As I was saying much earlier when we first started, Arizona does not regulate permanent makeup, so anyone can tattoo your face and not know a single thing about it. So I do encourage you to research, make sure who you're going to is legitimate and that they have training and that you're not their number 2 or 3 person. Because if you do get bad permanent makeup, it's very, very difficult to fix, and oftentimes there isn't anything you can do to fix it. So you don't want to be price shopping on makeup. Doing okay? For Kim, I'm doing a very pretty green color. There's lots of options for colors. We discussed that when you come in for the complimentary consultation. I do a consultation before all the procedures because we want to talk about you and what we're going to do and the procedure, before and after information. There's 2 procedures. So you're going to have the initial procedure, and then I see you back about 8 weeks later for the touch-up. I do have a lot of people who are only here part-time or maybe for a few months at a time, and they can't do their touch-up at 8 weeks, so they'll come back the next year when they're back in town. If that's the case, it's not a problem. You just let me know that, when we're doing the procedure, and then I make a note in the chart. Because typically if you're in town, you have to come in within 6 months for that touch-up. Open both eyes. Close. Yes. Yes. So people who have cataract surgery, or maybe they... Will you push my glasses up? Let me just do this.
Sorry.
People who've had cataract surgery, or maybe they have retinal problems or dry eyes, this is actually a reason why people have this done. Because if they have visual issues, they have a dry eye, and they can't wear topical makeup, that's why they seek this out. You just wouldn't want to do the procedure like during your healing of a cataract. But once you're healed, there's no issue. Okay?
Is there any withdrawal? Sometimes I read if you're having a CAT scan or something, they ask if you have
Good question. So Kim was mentioning, like when you have an MRI, how it'll ask you if you've had a tattoo. You do need to tell them that you've had permanent makeup. It does not affect your procedure. I had my knee replaced this past summer, and I had several MRIs, and I have permanent makeup. It's not an issue, but they will ask you about tattoos, and you just need to let them know. We're almost done, Kim. And as I was saying much earlier also, that the type of makeup that I do for brows and eyeliner, I am very, very conservative. I don't do real dark or real heavy. We can always go darker. You can always add when you come in for that second, procedure for the touch-up. But the key for me is to make it look natural and not made up like you're going out to a fancy dinner when you're going to be at the pool or the golf course. Open your eyes. Look right at me. Sorry, I know it's right at me. Look down. Open, but just look at your feet. Look at me again. Close. Almost done.
So let me start over. Who can hear that this is our consultation report? Okay. So this part is a neurotoxin.
You must have turned that speaker on again.
It works the same way as Botox, just a different reason. So this Cortez brand, it's been around for all the different countries. 25 years. It's very safe. And you have to last about 3 to 4 months, so you're going to have to get about 3 times a year. And today was special. We definitely stop about 3 times. You're going to get the break. So we're
Now I'm going to have you open both eyes for me. Good.
So bright, sorry.
Beautiful. Close. Okay, so she's done. What I'm going to do now is just clean around her skin, and then I'll sit her up and you guys can take a look, okay? So just keep your eyes closed.
And eyeliner, eyebrows, eyelid surgery, laser resurfacing, she does skincare,
So Kim is going feel beat up for about an hour. Okay, that's normal. Her eyelids are gonna feel puffy. She's gonna feel a little irritated in the eye. That will mellow very quickly over the next hour. And I just clean the skin because my gloves get kind of color on them, and then it gets on the cheeks and around the eyes. Her before photo should be somewhere where she has no makeup on. And that way you can see her without any makeup on her eyes, and then you'll be able to compare, okay? Now I'm going to have you open your eyes. Is it better with the light?
It's about the same.
Look right at the camera. How did you do?
I'm so surprised.
Yay.
Yes.
Okay, so I'm going to sit you up and I'm going to give you the microphone, okay?
Okay.
You want me to keep on going?
You can stop. Thank you. All right, so let me get